The following is an address to the nation by Prime Minister Dr. the Right Honourable Keith Mitchell on the novel coronavirus COVID-19.
Fellow Grenadians, brothers and sisters, we have entered a new phase in managing and preparing for COVID-19 virus. By all available evidence and based on the current trends we have seen in our neighboring islands, we expect that we'll soon see our first case of COVID-19 on the island. In those circumstances, therefore, and in order to safeguard our population against this pandemic and to contain this disease, the following measures will take effect on Monday, March 16th. All schools in Grenada, Carriacou, and Petit Martinique will be closed for 2 weeks in the first instance as a necessary precaution against the contracting or spread of COVID-19. Furthermore, teachers have been asked to work from home from next Wednesday, March 18. Educators and administrators are asked to report to schools on Monday and Tuesday, March 16th and 17th, to prepare all relevant materials needed to work remotely. Social distancing is a new term in the fight against COVID-19 virus. Accordingly to the experts, the virus is contracted from droplets when an infected person speaks, coughs, or sneezes, and either drops on a surface or on a person within 6 feet radius. We are therefore requesting that all public and other social gatherings, such as cultural, religious, and sporting events, cinemas, and other places that people gather, that cannot guarantee a minimum of 6 feet of social distances, be further suspended until further notice. It is paramount that we protect as much as possible all citizens, particularly our elderly, as they are the most susceptible to die in this outbreak. As we can all recall the sad events in the nursing home in Washington, when 29 elderly persons were the first recorded deaths in the United States. We are taking no chances and making no gambles on people's lives. In this regard, therefore, effective immediately, all visits to elderly nursing homes will be suspended until further notice. Those who are receiving at-home care are to exercise extreme caution. We encourage the general population, especially the elderly, to continue to exercise an abundance of caution in every practice to protect yourselves and your families. Those include constant and proper hand washing with soap and water, or the use of an alcohol-based hand sanitizer with at least 70% alcohol and disinfecting all surfaces using a mixture of bleach and water. As I stated earlier, social distancing is one of the established best practices in the fight against the community spread of COVID-19 virus. In that regard, we are asking that you refrain from using public transportation when possible. We encourage bus operators to continue to sanitize their buses using the bleach and water mixture. You will see aggressive sanitization measures taking place in public spaces where necessary. While the disease is serious, it is manageable if we all work together. By all accounts, supported by scientific data, 80% of COVID-19 cases exhibit mild symptoms and recover at home. 20% develop more serious illness. The highest risk of serious illness is in the people older than 80 years. People with serious underlying health conditions also are more likely to develop serious outcomes, including death. The people who are at greatest risk are those older and who also have serious long-term health conditions like diabetes, heart diseases, or lung diseases. I remind all citizens to continue to exercise an abundance of caution in everyday practices to protect yourselves and your families. Abstain from touching your face, eyes, nose, and mouth with unclean hands. And adopt social distancing practices as much as possible. Sisters and brothers, fellow Grenadians, this is not the first time the world has been faced with a crisis of such proportion. Neither is it the first time that the state of Grenada has been faced with a national challenge. If we act responsibly, collectively, and early, we shall overcome this. We have overcome challenges before, and we'll do it again. Our resilience is best revealed when we work together on all fronts. We have always been our brother's keeper, and will continue to do so. Call up your neighbors, check on them. Most of all, take all individual precautions to guard against and prevent the spread of this virus. I thank the Ministry of Health, and in particular, the Minister and his team, and all those on the front lines, working to ensure that no effort is spared in the management of this disease. Please pay attention to all advisories disseminated by the Ministry of Health and all relevant authorities. Remember, we are all in this together. Government will be speaking with the International Monetary Fund and other international financial agencies and other international partners shortly. And we'll be looking at ways and means to bolster this situation and to keep our economies afloat during and after this crisis. Fellow citizens, I can assure you that government is working aggressively, and we urge all of you to work with us on this. Already we have met with all major stakeholders, and we are assured of their support. The Ministry of Health will continue to lead all efforts and will disseminate updates as necessary. The National Disaster Management Agency has already been activated in coordination with the Ministry of Health and the National Coordinator of COVID-19, Dr. Mitchell. In conclusion, the government of Grenada will continue to monitor developments related to the virus and will review decisions as more information and updates are made available. Remember once again, we are all in this together. May God continue to bless each and every one of you. I thank you.
The proceeding was an address to the nation by Prime Minister Dr. the Right Honorable Keith Mitchell on the novel coronavirus, COVID-19.
COVID-19 spreads from person to person through the droplets that are produced when someone coughs or sneezes, which makes it easy to spread between people in close contact. Now let's get prepared to stay healthy.
To reduce your chance of catching or spreading COVID-19, practice these simple everyday preventative measures. Droplets can also land on surfaces, so ensure that you wash your hands frequently for a minimum of 20 seconds or sing the happy birthday song twice. Avoid touching your face, especially your eyes, nose, and mouth. If soap and water are not readily available, use an alcohol-based hand sanitizer with an alcohol content between 60 and 90%. 70% is ideal.
When you cough or sneeze, cover your nose and mouth with a flexed elbow or a tissue. Dispose of the tissue immediately and then wash your hands. If you notice someone has a fever and cough or other symptoms of respiratory illness, avoid close contact when possible. Let's all do our part to ensure that each and every Grenadian remains healthy. Our health is our collective responsibility.